Great. Thank you, Julie. And thank you, everybody, for joining us. I'll try to keep my remarks not necessarily brief, but at least free-flowing and as quickly as possible so we can get to some great conversation. It's great to have Dr. Mcint join today. It's been a while, Kara, since we've had you on. And, you know, I think in light of where we are with things, it's great to see you today. So thank you. Thank you, Dan, as well, for joining us, and Lacey, Scott, and Michelle, of course, who join me almost every week. So this is great to have all of us together. This is a great week for us, and actually a great moment of commemoration. I want to just really recognize the incredible work that all of us have put into the last 6 months. This is the week that we are commemorating, celebrating 6 months of vaccination in the state of Washington. And we have made an incredible amount of progress, which I will describe in just a moment here. But I just want to talk about the fact that while we are absolutely celebrating that success, we want to make sure that we recognize the amount of work that still lies ahead of us, because there really is a lot of work that still remains. It is absolutely important for us to remember that this is the time to continue to get vaccinated. We know that we are trying to safely get to reopening and to get to reopening as quickly as possible in the state of Washington. And that is something that is absolutely critical for all of us, because we want to enjoy that reopening, but to enjoy it safely. And I absolutely want to thank our media partners, as always, every week for everything you do to help champion our messages to the public and help them get through a very difficult time that remains with continued opportunities for engaging our community members. This coming Saturday is, as we know, Juneteenth, and I want to really recognize the importance of this. It is now established as a paid state holiday, as you know, in Washington starting next year. It's also an important time for us to remember that we all have a role and responsibility to address inequities, especially health inequities, and we continue to underscore the importance of equity as a cornerstone value for the Department of Health, but also racism as a public health crisis has been recognized in many places across the country, including here in our state. I also want to recognize that in addition to the 6-month commemoration, as well as the Juneteenth commemoration that's coming up this Saturday, we still have a number of milestones that are ahead of us. But why don't we go back in time a bit? If we can show that first slide. Again, I want to just remind everybody of the road that we've been on. Again, I know when we first showed this months and months ago, it seemed maybe a little bit of a dream that we were going to get to this point where the three-legged stool was no longer going to be about vaccine supply, and it wasn't going to be about logistics, and that we were going to move into that third leg of the stool, which, as you know, has been over the last few months, which is really about demand. If I can get the slides to come up, I was trying to pause as much as possible and wait for them to come up. And
are we not seeing it? It popped up on TVW, but I will reshare and hopefully you'll be able to see that. Are you seeing it now, Dr. Shaw?
Yes.
Great.
Great. So three-legged stool, again, just a reminder that this is really about this journey with initially supply constraints, logistical constraints, and now constraints really related to vaccine demand, and whether that's hesitancy, whether it's an access issue, whether it's somebody that's just been too busy or thinking it's not important enough issue. We are really very much focused on the demand side of the house. That does not mean that supply and logistics are not important. They are, but really demand has really been where we have been focusing. And certainly our launch of the Caravan this last couple of weeks has really been very important for us as we move into a new way for COVID-19 response in the state of Washington. If I can go to the next slide, thus far in the last 6 months, we have administered over or just shy of 7.5 million doses in the state of Washington. And I, again, just want to reconcile recognize the incredible work that this has been with all of our partners, especially our local health jurisdiction and community partners, our healthcare private sector, and everybody else who has come together to be able to administer vaccine throughout the state of Washington. Last week, I had a chance to be with our healthcare authority fellow director, Sue Burge, as a nurse, and myself as a physician, and we were able to really talk about the importance of, from a doctor and a nurse standpoint, of why it's important to get vaccinated. And I want to thank Director Burge for just being such a champion of vaccines as well from a nursing standpoint. Certainly I am from a physician standpoint. Hopefully that makes a difference to people in the state of Washington as well. We can show the next slide as well. As you can see, we've had more than 67%, 2/3 of our population 16 years of age and above that have received at least one dose. And we are doing very well as a state compared to other states across the country. Again, testament to the hard work. But as you can see, if you have 2/3 of the population that have received at least one dose, there's the other side of the equation, which is 1/3 of our population has not. And that means that is the area of focus. Those are the people that we are focusing on because we want to make sure that they are also being protected from this horrific virus. I did want to also make a quick comment that this represents more than 4 million people, 4.1 million people with at least one dose. And for comparison purposes, our state childhood vaccine program usually provides about 3 million vaccines any given year. And so we have far exceeded that in just 6 months of activity. And that just underscores how important this work has been for our state and for our communities. The next slide shows, since January of 2021, our COVID-19 hotline, and we want to thank our media partners for getting the right phone number out there for our community members. 833-VAX-HELP has fielded close to just shy of 90,000 calls and scheduled over 32,000 appointments. And I think that's, again, a testament to working together to provide accurate information, but also information about where people can get vaccinated, and also to most recently field calls related to the registration or lottery purposes of people wanting to check if their information was in the database, for example. The next slide is something that I really want to recognize the people that are the people behind the people, if you will. So when, Scott, Lacey, Dan, Michelle, and Kara today, when myself, all of us are here in front of you, there are an incredible amount of people that are behind the scenes that are working to make sure that things are successful. And I just have to give a shout out to our C4PA, our communications folks, our engagement folks, our equity folks. And I really want to recognize, if our media have not seen this, I wanted you to be aware that we have been selected by the Public Relations Society of America, RSA, for 7 Silver Anvil Awards and 2 Awards of Excellence for campaigns, including for WA Notify and Spread the Facts, as well as our multicultural outreach. And I want to also recognize our partner at C+C, who's worked with us and helped champion this work as well. But this is just an incredible testament to the communications messaging. And I know you all in our media have seen that we have really stepped up our game when it comes to communications and engagement activities related to a whole host of whether traditional or social media activities. And I think that is absolutely been amazing, but it has required a lot of work behind the scenes, and it's great to see the team being recognized for that. So I want to say kudos to our communications team for these recognitions, and I know that there are going to be other recognitions, but the most important thing that each of our communications team member will say is not about the recognition, it's about the work and the mission. And I want to really recognize just the selflessness by which they've been working day and night and weekends and long hours to be able to approach the 24/7 news cycle that's out there. If I can now segue into our trends for where we are as a state, and I know this has come up quite a bit over the last week or two, because we've had some questions that have come up from people about reopening. And as you know, that Governor Inslee had set June 30th as the date for reopening, unless we had administered, or were able to administer for those who are 16 years of age above, 70% getting one dose of vaccine. And so we've had some questions that have come up, given that the federal government a couple of weeks ago had announced that we had hit 18 plus at 70%. So people said, well, is that the metric? And then certainly we were looking at our metric that we have continued to use throughout the pandemic, and have been steady and steadfast about this metric. And as you can see here, which Michelle is going to be talking about as well during her presentation, that we have estimated that we are at just above 67% of those who are 16 years of age or above with at least one dose. Now, this includes the DoD and VA additions to our numbers, as you saw over the last week or so. Again, we now, over the last couple of days, had some questions about CDC versus DOH data as well, and Michelle will be talking about that. And while we are close to 70%, as you can see, we've hit it with 18 plus population, given the census estimate that the CDC and the federal government were using, with the 16 years of age and above, and adding the DoD and VA, and using our OFM estimates, which we believe is a more recent calculation of population in our state. We're not quite there. We're at 67.2%, give or take. We were very close to that 70% mark, but I did want to highlight, and maybe later, if there's a question about this, Lacey or Michelle can say this as well, that represents still 140 to 170,000 individuals that would need to initiate vaccine, 16 years of age and above, in order to be able to get to that 70% mark. So we're still not quite there. I think that's the key message, but we are making progress. And I want to thank the governor and our governor's office, as well as the Lottery Commission, who really put together an incredible amount of incentives, because we do think that has helped continue the interest in vaccines. And we're hopeful that will continue to translate into people rolling up their sleeves and getting vaccinated. So the other thing that I wanted to, if we could show our epi curve, we have had almost 445,000 confirmed and probable cases of COVID-19 in the state of Washington to date. That means almost, unfortunately, translates still into 5,800 deaths. I know we're nearing the 600,000 mark of deaths in the United States. I think it's really important for us to remember that we are not out of this pandemic, even so now, and we want to make sure that we do everything we can to not see these curves come into the opposite direction. As you see, the cases are declining statewide in most counties. We may be seeing some flattening in some areas, but for the most part, we're making great progress. But at the same time, we need to keep vaccinating, because that is really ultimately that, plus taking precautions, especially if you're not vaccinated, if you're unvaccinated, is really what's going to allow us to stay on track and keep seeing these declines. And Dr. Lindquist can go into any of these details as if you have any questions about that as well. So I want to just really talk for just a moment about the importance of vaccination and what happens at June 30th or earlier after the state reopens. We know that mask requirements won't fully go away. We've already been mentioning that we want people to respect the rules of the room, so to speak, whether it's a local jurisdiction or whether it's an establishment like a business. Again, fully vaccinated people are going to really see a near return to normal, that it is going to be that masks are not required except in certain high-risk settings and in communities or businesses or establishments with stricter rules. We want to make sure we, again, respect those rules. However, for unvaccinated, there is still going to be the requirement to wear masks in public. And the Secretary Mask Order will still state that masks will be required for unvaccinated people indoors and in crowded settings outdoors. And we want to still remind ourselves of the 6-foot distance if you're unvaccinated. We also particularly want to remind parents that if they are vaccinated, they should also be considering how to keep their kids protected if their kids are not eligible to get vaccinated because of age. That is so critical for the work that we want to not undo any of the work that we have done thus far. The bottom line is, if we want to take our masks off in public and do so safely, the best option is to get vaccinated. And why is this critical? Now, if I could show this last slide that we have, and this is something that we have talked about previously, but as you know, if you look at this, as of May 29th, as we're looking at our hospital admission rates for unvaccinated people 45 to 64, they were 21 times higher risk than vaccinated people for hospitalization and for age 65 and above. On the right here, the rate was 15 times higher in unvaccinated people. So what does that mean? Bottom line, if you were unvaccinated in the state of Washington 45 years or over, you have a 15 to 20 plus time risk of being hospitalized from COVID-19. If there is not a compelling enough reason that we want to safely enjoy reopening, we want to, maybe some people want to win some money, shot of a lifetime. We want to make sure that people are doing what they need to do in order to protect themselves and those around them. Certainly these data show that we have those who are unvaccinated and are still unprotected and thereby getting hospitalized. And we are also seeing those who are protected who are not getting hospitalized because they are by and large protected from COVID-19. So it's really important that we do not see, as you've heard me say for multiple weeks now, a tale of two societies where those who are protected are vaccinated are protected. We also want to make sure that we have as many people in our state vaccinated so we can protect them and we have lower rates of outbreaks throughout the state of Washington. So let me close by just saying again, immense progress in the first 6 months. Still have a lot of work to do. Juneteenth is coming up on Saturday, and we want to make sure that people are recognizing and commemorating that important holiday. But at the same time, we want to also recognize the incredible work that is still going to remain, even if and when we hit that 70% mark of 16 plus who have received one dose. We still have a third of the population to go, and we need to do everything we can to keep that momentum going. Please remind everybody to talk to their friends, family, neighbors about vaccination, ask about concerns, roadblocks, sharing reputable resources and sources of information, and most importantly, offer to help find or get an appointment for people so that they can get themselves protected from this pandemic. And again, I want to thank our media partners and everybody else that's been working to help us over the last 6 months. And with that, Julie, I will turn it back to you. Thank you.
Thank you, Secretary Shaw. Next, we will go to Assistant Secretary Michelle Roberts.
Good morning, everybody, and thank you, Secretary Shaw. I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team for the Department of Health. Before I fully get into some of my remarks, I also want to join Secretary Shaw in taking a moment to reflect on the past 6 months of vaccination in Washington and thank the more than 4.1 million people who've received at least one dose of COVID-19 vaccine. Last spring, when we were starting to talk about vaccines, never in my wildest dreams did I think we'd have a vaccine. And now, a year later, have vaccinated so many people in our state. It's really been an incredible journey, and it has taken all of us to get to this point. Healthcare providers and public health staff working long hours to ensure vaccine is available, and all the Washingtonians who got vaccinated and help friends and family get vaccinated. Thank you. Thanks to all of us, our communities are safer, we have saved lives, and family and friends are reuniting. We're closer than ever to fully reopening our economy, but the work is not over yet. To reopen before June 30th, 70% of people 16 and older need to get at least one dose of the vaccine. We're getting closer every day. Right now, we're at 67.2%. To reach this point, though, we need at least 140,000 Washingtonians to get their first dose of vaccine. So that exact date on reopening will depend on all of us. Recently, some questions have come up about our data dashboard compared to CDC's. As I've shared before, there were a few reasons for the differences. The federal government is reporting data for people 18 and up, and they're using older population estimates for their denominator. And the CDC has data from sources DOH does not have access to. To help bridge the gap, we've incorporated more than 150,000 doses from the Department of Defense and the Veterans Affairs into our calculations, bringing us to the total we're at today. Unfortunately, we're not able to add federal government data into our state dashboard because it is aggregate data and incomplete information. It isn't person-specific, as is all the other data on our dashboard. We'll continue to update you on our progress as we get closer to 70%. Another popular question we've been getting is about if lottery incentives are getting more people to sign up for vaccination appointments. This week, nearly 4 million adults and more than 200,000 kids and teens were entered into the state's Shot of a Lifetime giveaway series. Before the lottery announcement, we were seeing a decline in vaccinations. The governor announced the lottery less than 2 weeks ago, and due to data lags, it's still a bit tough to get a good idea of the vaccination trends. I can tell you that vaccinations were up last week for the first time in more than a month, which is great. And 60,000 more adults were entered into this week's lottery compared to last week. If you're trying to access your vaccination records through MyIR and you're having difficulties, please reach out to our COVID-19 hotline. Can I get that graphic up? The number is 833-VAX-HELP. They can help match you in MyIR and let you know that your data is in our Washington State Immunization Information System. Once again, the number is 833-VAX-HELP. Later this year, we could have another COVID-19 vaccine in our toolbox. Novavax announced its vaccine was found to be safe and 90% effective in a large clinical trial. The company says it plans to file for FDA authorization this summer or fall. If authorized, the vaccine could be used both in the US and across the globe. Global vaccinations are an incredibly important piece of this puzzle and helping us bring an end to this pandemic, especially as travel picks up. We are very encouraged by the commitment of the US government to provide vaccines worldwide. Finally, I want to switch gears and share with you that our state-led mass vaccination site at Spokane Arena is closing tomorrow as DOH continues its transition to mobile vaccination clinics. Since reopening in January, the Spokane site has given out more than 75,000 doses of vaccine. Our mass vaccination effort was incredibly successful, and I want to thank everybody who was involved. If anyone has questions about the COVID-19 vaccine, please visit our website to check out our frequently asked questions or talk to your healthcare provider. To make a vaccine appointment today, visit our vaccine locator website. You can text your zip code to GetVax, which is 438-829, to receive addresses of nearby vaccination sites, or call our COVID-19 vaccination number, 833-VAX-HELP. Thank you.
Thank you, Michelle. Next, we will go to Dr. Scott Lindquist. Dr. Lindquist?
There you are. You can hear me okay?
Yes, we can hear and see you.
All right. I just wanted to give a very quick update on our variants. We are one of the states that really does an aggressive job of monitoring our variants. Most states are around 1% of their isolates are analyzed for variants. And in Washington State, we, in May, looked at 11% of all our sequence samples. The goal here in Washington State is to do all positive samples eventually, but we have a really good handle on the number of variants and what variants are predominant here. there's a couple things in the variant world that have changed recently, and that's a new nomenclature. And I think everyone's still struggling to get a hold on this. And the big issue is this variant called Delta variant, which is a variant. It's what we call B1617. There are three variants within this: 0.1, 0.2, and 0.3. The WHO is really focused down on 0.2, which they call the Delta variant, which is getting a lot of attention in the media right now. But we actually monitor for all the B1617s, 0.1, 0.2, 0.3. But everyone's struggling to get a hold of this nomenclature. We call the 0.1 Kappa, and we call the 0.2 Delta. And Delta is the one that's received so much attention. And the main reason it's getting a lot of attention is because around Europe and certainly in India, they have seen increased hospitalizations, increased deaths, increased transmissibility, decreased responsiveness to antibodies, both antibody response from vaccine or manufactured antibody. And so what we do here in Washington is we monitor everything closely. I can tell you our biggest variant of concern in Washington state is the Alpha variant, or what we call the B117, which is what was also previously called the UK variant. That is over half of all the variants we see in Washington state. And again, there is some evidence that it's more transmissible, it has higher hospitalization rates, et cetera. And then our second variant of concern is the Gamma variant, or the P1 variant, or the variant from Brazil, previously named. And then our Delta variant, which is about 6% of all our variants. So the Delta variant is not the major player here in Washington state. It is increasing. And so that's the benefit of sequencing 11% of all our samples, is we can keep a really close eye on this. To be clear about what we are seeing with the Delta variant, it is 3% of our breakthrough cases, which is less than the average, which is 6%. So we're not seeing it predominate in our breakthroughs, which means that our vaccinations are still holding against this variant. We are seeing about 3.5% of the folks with this variant are hospitalized, which is below the average of about 6%. So we're not seeing increased hospitalizations here. And about 0.5% with this variant in Washington state have died, which is less than half of the average for variants in Washington state. So we're not seeing increased death in this variant. And what makes this variant unique, by the way, is there are proteins on the outside of the virus called spike proteins. And this one has mutations in about 9 of those spike proteins, which makes it of concern. And of course, when you're seeing increased transmissibility, decreased effectiveness of vaccine worldwide, that's a concern here. I'm very confident that we will see any of these changes if that variant expresses these same concerns here in Washington state, but at this time, we are not seeing it. And with that, the issue, this was reclassified. There's this whole classification from CDC about variants of high consequence. We do not have any variants of high consequence in the United States. That means where vaccine is not working, where we would have to do something different for treatment, isolation, quarantine. We have none of those variants in the United States. Then we have these variants of concern, which are variants that have increased evidence of transmissibility and are decreased effectiveness by vaccine. That is what classifies you as a variant of concern. That doesn't mean that will express within your state those findings. And then variant of interest is one of these that has the potential to do that. So this Delta variant was just reclassified as a variant of concern. And that's why I'm spending time to really go through this and let you know what our experience here in Washington state is. And with that, I'll turn it back to you, Frangie. Or sorry,
it's me today, Dr. Lindquist.
Sorry, I said
Frangie set the standard very high, and I seek to achieve her level of greatness.
Everybody is Frangie. Everybody is Frangie.
That's the nicest thing anyone's ever said to me, is to compare me to Frangie.
That's sad. All right, I turn it back to you, Julie.
All right, thank you. Our final panelist will be Dr. Kira Mauset. Go ahead, Doctor.
Good morning, everybody. Thanks for having me back. I'm happy to be here this morning. I am the co-lead for the Behavioral Health Strike Team, which is part of the larger behavioral health group here at DOH. So not surprisingly, I'm here to talk about behavioral health issues related to reopening and the return to workplace stuff that might be coming up, and also what the summer months kind of may hold in terms of behavioral health concerns for folks. So I was asked to share a little bit about this because we're entering probably one of the strangest periods of ambiguity and tension and uncertainty in modern history. Nobody knows how or exactly when the pandemic is going to end and what the artifacts kind of in our relationships and in our families and in our workplace environments will be when that actually happens. So we don't know for sure what's going to become of some of those things. And that can be really disconcerting and really uncomfortable for people. Ambiguity, generally, like the sense of not knowing what to expect, generally is hard for people to tolerate. So humans don't like it. We like to have a plan. We like to know what's coming. And the pandemic has been at various points sort of easier or harder when it comes to that, to the not knowing. But the transition out of it, in whatever form that takes, is probably one of the most challenging experiences of ambiguity yet. So we can't plan on knowing how all that content will turn out. So what we can rely on during this time is focusing on how we do things rather than what. How we talk to other people, how we listen, how we behave towards a stranger at the grocery store or in a business meeting, meeting new people, the way we act and the processes that we choose to interact with other people and just to make choices generally, that's where we have power over the next several months because things are shifting so quickly that we might not know the what. We might not know what to expect, especially when it comes to workplace transitions. So taking a pause before we respond, before we make decisions, and focusing on the power that we each have over how we do things, the process in our day-to-day lives, that is really helpful right now. And it gives us a sense of control, and it's more effective than just waiting to focus on the what's to get figured out by someone else and then feel paralyzed until they do. So that's where our power is in the process. As we transition from at-home work in some cases to hybrid or return to office, people are really having a mixed range of reactions to that. So there's a lot of anxiety and fear for some folks. There is a lot of enthusiasm and relief for other people, and pretty much everything in between. Because the policies and guidelines and expectations vary so much between companies and organizations, and even on teams within companies, interpersonal relationships are also kind of likely to become strained. So I'll explain more about that in a second, but basically we owe it to ourselves and the people that we are around on a day-to-day basis to try and show compassion, to focus on that, and to do our best to understand that how we feel about this process and the return to work idea is probably different from the person who's sitting next to us. There is a potential right now for increases in stigma around behavioral health. So some folks are on a different trajectory. They're on a different recovery timeline, and they've had a very different experience of this pandemic. And there's nothing wrong with that. But I'm worried that some of that stigma around how they're doing versus how other folks are doing may play out in the workplace. The data that we are collecting on symptoms of depression and anxiety in the state show that many adults are feeling a lot better right now, especially compared with, like, let's say, early winter, January, February. There are lower rates for both of those things for folks over 18. So listening and learning about the experiences that other people are having and not assuming that your feelings about the summer, your excitement, or your fear is the same as how other people feel is a good place to start. Again, listening with compassion, trying to understand what other people are going through. And there also, I have to note, is a pretty significant risk that there's maybe an increase for behavioral health symptoms, including anxiety and sort of trauma responses for members of the BIPOC community who are coming back into workplace environments, or potentially, where they may experience an increase in discrimination. They may be going back into an environment where they experienced hostility or racism or microaggressions. So just being mindful, again, that people's individual experiences are their own, and that when we communicate with other people, we should try to understand other viewpoints and other experiences as much as we can. Cognitive dissonance is one of those things that also is likely to happen more as we go into the summer months. This is when we struggle to deal with our own changes in attitude and belief. For example, let's say you have a buddy at work and you really are looking forward to seeing them and getting back together and seeing them in the workplace, but that workplace friend feels very differently than you do about issues that are really important to you, like vaccines or masking or distancing or what have you. So if that happens, our human brain tendency is to either like the other person less or to change our opinion. And we don't like doing either one, which is what results in cognitive dissonance. And that discomfort, that feeling of like, I don't know what to do here, is likely to be kind of pervasive as we go through this transition and we shift back into these workplace contexts and communication. So it causes exhaustion to feel so conflicted, but it is something that you can work through. You can just talk to other people about it and learn more, and that helps with that process. Also, with regard to the summer, please be aware of the tendency that we all have, but especially young people, to participate in risk-taking behaviors. So there is this sense of need to blow off steam after the year or more that we've had. That's fine, that's totally understandable, but there are ways to have fun and blow off steam that aren't dangerous. So choose a designated driver if you go out and there's drinking involved. Make a plan for that. Check in with young people, young adults, have a sense of what they're doing, who they're with, where they're going. Risk-taking and the potential for accidents generally increases during the summer months. The weather's nice, we go out, we have fun. But given how many of us are feeling about wanting to get back out there and into life, keep in mind that we still need to be careful about following those guidelines. And it's hard not to be impulsive, but we need to pause before we make decisions about things. So our resilience has been growing this whole time. I've been talking about resilience for a long time. And we can take the opportunity in this transition to continue to focus on those things that are fundamentally important to each one of us, those core values. And we use them as a way to navigate this uncertain time. It's the process that we use. It's okay not to have answers about all the what's that are going to happen because we don't know. So we focus on process more than content, and we focus on those elements of resilience, purpose, connection, adaptability, and hope. And we continue to develop it along the way. And that's it for me today. Thank you, Julie.
Thank you, Dr. Masa. I think we can all identify with what you just spoke about. This brings us to the question and answer segment of today's briefing. We have 7 reporters in the queue and about 20 minutes left, so we'll do our best to get to everyone. We begin with Carla from the AP. Carla?
Hi, thanks for taking my questions. I'm wondering what recent data you may have about who is dying from COVID-19 now, how many are unvaccinated, and among those deaths that are breakthrough cases, what proportion of those vaccinated deaths are among immunocompromised people?
Yeah, here, I'll take the first look at this. So, it's a great question. It's way more detailed than any of us have the information here on this talk. But I think what would be best is if we connect with you afterwards and give you the detail. It takes a lot of explanation. I got to dig it up, and that's the best way to get you some good info rather than, going off the top of our heads here. One thing I will tell you is the majority of our cases are occurring in people that have not been vaccinated. It makes sense, of course, because you wouldn't get infected. We are having breakthrough cases, though. Our breakthrough cases really are not unexpected. We've been working with the CDC to really look at what was the projected number that we would have, and we were right where we would expect them to be. That's been about 2,039 breakthrough cases, of which 78% of those are symptomatic. The others are not symptomatic, but they're identified through outbreak investigations. It is true that about 10% of these folks have been hospitalized with breakthrough, and there were 36 deaths associated with breakthroughs. Again, a lot of these conditions have a massive amount of comorbidities. So like you're talking about people in their 80s in a nursing home with underlying disease. So it's not unexpected. We are not seeing a massive number of deaths, but certainly in our cases and hospitalizations, we're seeing a overrepresentation of people that aren't vaccinated. But we can work with Julie to get you some real details to those questions you're asking about immunocompromised and other. Anybody else have anything to add?
Absolutely. Dr. Shah, do you have anything to? Dr. Shah, did you have anything to add? I'm having a little bit of connectivity. I make sure we covered all of our bases. All right. We will move on to our next question from Jessamyn at Q13. Jessamyn.
Thank you so much for each and every week that you guys do this. And I would like to echo Dr. Shah's earlier sentiments about the team. Very much appreciate Julie and everyone on the communications team who do not go 24 hours without receiving anything from me. So thank you. I do have a question for Dr. Lindquist. I know that you are on a panel tonight for which has to do with education and the return to school for children. There are certain parents who are concerned about having their children return to school when they're not yet eligible for vaccination. So what would you tell them to make them feel that it's safe? And would you recommend a hybrid model? And do you have any more information on when a vaccination for those under 12 might become available?
Okay, there's a lot of questions in that question. So I'm gonna do these one at a time. Yes, I am on a panel. Today will be a very long day. So I will try and maintain my cheerful demeanor through the night. But the bottom line to the question you're asking is really about giving parents choice, to understand the science, to understand what choices they can make, to understand what choices certainly I have made for my own children and myself that have worked. So, you know, some of those things are, and there are a lot of debate and a lot of misinformation about some of this opinions. So around mask wearing. And, you know, one of the things I will tell people is I have been in every prison, most migrant camps where there's been outbreaks, and I have been in there wearing a mask, testing everybody, and neither myself or anyone on my team has gotten infected with COVID. So that is a very powerful experience that I'm going to communicate how effective masks have been. It's not all about vaccines. And then the other question that you were asking is, you know, what about the hybrid model? And again, you know, Chris Regdahl is going to be on this, the superintendent. And one of the things that's going to be a theme we're trying to make sure is parents understand their options, and so that they can make choices that they are comfortable with their kids, and we will give them the science and the experience that I just outlined like that. So that will be the goal of this evening. Yes, it will be a long day for Dr. Lindquist. Okay, thanks.
Hey, Julie, can you hear me?
Yes, Secretary Shaw, we can hear you now.
I'm so sorry. I had to drop off and restart, and I had tech issues. So I missed the first two questions. So I think the team probably answered them. I honestly don't know what they were, but I appreciate that Dr. Lindquist is going to have a long day.
Yes, and we will be following up with Carla from the AP as well. So let's move on to our next question. And thank you, Jessamyn, for those questions. We're going to check in now with Arielle from the Spokesman Review. Arielle.
Thank you. My first question is for Dr. Lindquist about the emergence of new variants like the Delta variant, and if the continuance of emergence of variants increases the risk for those who are not vaccinated and in those Washington counties with lower vaccination rates. And my second question is for Dr. Moseth to see if our inpatient psychiatric bed capacity, particularly for adolescents, is still very tight statewide. Thank you.
Kira, do you want to go first?
Sure.
All the questions hot on your mind. Go.
Yeah, the short answer is yes. Bed capacity was an issue long before COVID hit as a disaster, and it's become an extreme thing, which is why the governor declared the crisis for youth recently. So yeah, we still are short of beds, and we're working on a variety of measures to address the youth behavioral health crisis right now that really needs to be a priority in terms of behavioral health.
And I'll give you, Arielle, an understanding of where our variance is going. So again, you heard me say earlier, we're really sequencing over 10%. Last month we did 17% of our variance. So we have a good idea in Washington State what percent of all our isolates for COVID are variants, and the answer is almost all of them. So it's an issue of which variant is predominating, and a lot of us were concerned, and I'm sorry to do this to you, but the Alpha variant, which is B117, which is the UK variant, sorry. And by the way, Arielle, in the variant report that gets updated every Wednesday, next week we'll have a translation of all these terms and names we had, so it'll help you, keep track of them. But the Alpha variant has been our biggest concern. That is the B117 or the UK variant. And that took off. We had a lot of concern that this was going to be the only strain that we saw. And for a while, it got up around 70%. That is being outcompeted in a sense that it's about 54% of all our variants that we're seeing. But what is concerning to me is 16% of these, and a very quick rising variant is what we call the Gamma variant. I know that just rolls off the top of your head and you know exactly which one I'm talking about. That is the P1 variant or the Brazil variant, which has, of all the variants in Washington State, has a higher hospitalization rate than the average for all variants. So I am very concerned about the P1. And where we have seen this P1 is exactly in the areas that you talked about, where low vaccination rates, we've seen it across the state, of course, but we're seeing it in some outbreaks in Eastern Washington. We're seeing it in counties with low vaccination rates. And I'm very concerned the role that this P1 is going to take. It has increased its percentage in the state. And if that isn't enough, we've got this Delta variant, so the B1617. 0.1, 0.2, 0.3, which is what's called the Indian variant. We're seeing that slowly start to rise, but are not seeing a concern for hospitalizations and deaths and otherwise. But in these areas, if you are unvaccinated, this could be the predominant variant in your outbreak. And so the only thing I can say, and I would just say it over and over, is get vaccinated so we can hinder the spread of these dangerous variants in the state. With that, I'll turn it back to you, Julie.
I think it's Frangie. I want to be Frangie for the rest of the day, please. Thank you, Dr. Lindquist. And thank you in advance for your very long day that I know is ahead. We are going now to another question. This is from Nicole from Cairo Radio. Nicole.
Good morning. Looks like I'm going to stay on topic there with the variants. I'm wondering how well our vaccines work against the Delta variant. And then with all four of these variants, is there a scenario where we could see, despite vaccinations, where we could see restrictions reimposed because of these variants? And I mean, what would it take to get to that possible point?
Anyone else want to take? I'm happy to answer my opinion on this.
Since I've been having tech issues, it's actually been great, Scott, because I've been just listening to answers. This is great.
Yeah,
so go for it.
Nicole, I think that is exactly what keeps me up at night. I got to be honest. The last thing I think about before I go to bed are the variants, and the first thing I think about in the morning are the variants. And so part of that is why we're so aggressive about monitoring for it, which is the real answer. There are studies that are being done across the globe, especially, a recent study came out of Scotland looking at how well the vaccines worked against this. They found that this is the predominant strain in Scotland. That is not the same thing we are seeing here. We are not seeing massive amount of breakthrough, which would probably be the first signal we would get, is that the majority of our breakthrough cases are occurring with the P1 variant. We are, with any breakthrough that we get, we are genotyping those, just so you know, just to really make sure we're catching this. So that would be our first signal that this vaccine is the predominant reason for breakthrough. We are not seeing that yet. We would also see this variant become a higher percentage in the state. We are not seeing that yet. Again, still B117 or the Alpha variant is the predominant strain. And I think the companies are looking at this globally, and they're looking at the effect of their vaccine. You know, the vaccines in Europe can be different than the vaccines here. So what we are interested in is Pfizer, Moderna, J&J response to this, which still has is still effective against this strain. So we may see a very different picture here in the US and certainly here in Washington, but if this becomes an issue and the vaccines are not working well against this strain, I know the company, and Michelle, you can jump in on this, I know the companies are looking at boosters specific against these variants. I think that would be our next step. And then, of course, if we start seeing our incidence and our percentage of cases going up, of course, we would do some distancing as needed. But I think that's way down the track, and there's a lot more here, which leads me again to the same recommendation: to avoid any of this, we just need to vaccinate more people so that this variant cannot get a foothold in Washington state.
Thank you, Dr. Lindquist. We have 3 reporters left. The next is Jake from King 5. Jake?
Hi, all. Thanks for taking our question. Just a couple of questions on 2 different topics, if I may. First, the epi curve that Dr. Shah was showing appears to show a little flattening, actually, in recent days. I'm just curious if you have an indication of what that might be. And second, we've had several people reaching out to us at the station say they don't answer long-distance phone calls because they're usually spam, and they're wondering if lottery officials are leaving messages. Thank you.
Thanks for that question. And our team put up that curve. As I had mentioned, that we are seeing, a continued progress. And of course, there is some, as you mentioned, it looks like there is some flattening. It's too early to tell if this is a trend or if this is really just a continuation with a downward plateau. I think the key message is that we continue to monitor this on a regular basis to know what's happening. And certainly we know that there are going to be, if you look at it from county to county to county, which we do, there are certain parts of the state where we do have some of the more pronounced declines, and others where it's more flattening. And so, from our standpoint, this gets back to Dr. Lindquist's message about the importance of vaccinations, whatever we can do to continue to fight this pandemic and flatten this curve, but actually make sure that it's not just flattened, but it's going in the downward direction. The other piece of it is, frankly, that our cases are really in those more than, like I said, 15 to 20 times more risk for hospitalization. That also translates to those who are COVID positive, who are unvaccinated. So I think part of this is related to vaccinations. I think part of it is related to people feeling that we're out of the pandemic. It's summer, it's done, and we're finished. And that is my one concern about the 70% mark or the reopening, is that people will think that we're done and we don't have to worry about, any safety precautions. If you are particularly unvaccinated, you have to be concerned about how do you protect yourselves and the people around you. But ultimately, it's also about if you are vaccinated, we want to make sure that you're encouraging others around you. We still have a third of our state who are 16 years of age and above that are still unvaccinated. So it's a combination of variability across the state, combination of vaccinated versus unvaccinated. And certainly it's also people not taking the precautions that they should be taking, especially if they're unvaccinated. And then we also have to be mindful of kids who are not eligible for vaccines, and whether that also puts them at some risk for COVID-19 because they're unvaccinated as well. So a few of those issues that I guess I would bring into the mix.
I can answer the lottery question. Lottery will leave you a message and they will try more than once. One thing lottery will not do is ask for your social security number or your bank account information. And the Attorney General's office did put a warning out that there unfortunately are some scammers out there pretending they are lottery staff asking for that level of personal detail. But the good news is if you are winning a prize, lottery will leave you a message and will try to contact you more than once.
Thank you very much. Our next question comes from Steve at Como. Steve? We are working to unmute Steve right now.
Hello, can you hear me? There we go. Thank you all for the time. I wanted to ask a follow-up regarding the vaccine incentives. I know Michelle had mentioned that vaccinations were up last week for the first time in more than a month, but I'm curious, what does that tell you in terms of the incentives through the Shot of Lifetime campaign? Is there a way to gauge how well those are working? I think one of the things that Lacey mentioned last week was there were some early signs that the incentives appear to be working in driving up the vaccination rates, but are we still in those early stages, or are you getting a better sense of the actual effectiveness of those or the impact they're having?
Yeah, if I could just, Michelle, if I could just jump in really quickly and say, we do believe they're working. The question is really, it's a hard one to answer because you don't know what the rates would have been if you didn't have those incentives in place. But we had been seeing, declines week over week with vaccination initiation. And so one of the promising developments since the Shot of a Lifetime lottery campaign is that you've actually not seen that kind of decrease or that precipitous decline that we were seeing previously. And so we do believe that those incentives are making a difference. The quantification piece is really the hard part of this. We are trying to do some modeling behind the scenes. I think I alluded to this last week, but again, it's a bit early for us to be able to unveil or share anything because this is so recent. But I will say that ultimately, whatever the incentives are, whether it's a financial incentive or whether it's I want to help my family stay protected incentive, or it's I want to get the state reopened earlier than June 30th incentive, or whatever it is for a community member, we just want to continue to encourage people to get vaccinated. Michelle, did you want to add anything to that?
I think you covered all the high points. We're working to do a detailed analysis of this once we have more data. And it really is, part of it is there's a data lag. Providers have up to 3 days to report, and sometimes it takes up to 5 days to get the full data picture in. So it does take time. We know we were declining and now we're not, which is a great thing. And we know that more than 60,000 adults were entered into the lottery this week compared to the previous week. So those are all good signs. And we continue, incentives are going to be individualized. What may motivate one person to get vaccinated may not be the same thing that motivates somebody else. And what really the bottom line is, we need all Washingtonians who haven't been vaccinated yet to get vaccinated. Now is the time. If we want to reach that 70% metric, which is a place on our journey, as Dr. Shaw said, it's not the end of our journey, but it's really going to take people who have not been vaccinated, making time and prioritizing that and going out and getting vaccinated. And if you have questions or concerns, we have FAQs on our website, and we really encourage you to also talk with your healthcare provider if you need more detailed information.
One other thing that I would just add, I would be remiss if I didn't, as I mentioned, the public service work that with Healthcare Authority that we shot this PSA last week with Sue Birch, is the importance of healthcare providers. And, I think all of us would agree that there are many people that are also wanting to talk to their doctor or their nurse or their healthcare provider and have a conversation. And we want to encourage, and in fact, we would really ask the help of our healthcare system, doctors and nurses and all sorts of other healthcare professionals have done an amazing job for this year plus in fighting this pandemic. And they're the first to know how important this is to get people vaccinated, because it ultimately gets us out of this pandemic. there's a recent study that was done by the American Medical Association, which shows that 96% of physicians are vaccinated themselves. And I think it's really important for those same doctors and nurses and all sorts of other healthcare professionals. And this isn't just for primary care. This is also specialists like orthopedic surgeons and cardiologists and all those colleagues that are out there that are doing all sorts of different activities. We want to make sure that they are actively getting their patients or their clients into the mix and saying, look, even if I myself cannot vaccinate you, I want to encourage you to get vaccinated. Please go somewhere and get vaccinated. We've been working with our medical association partners at WISMA, at the Hospital Association, at WISHA, and all sorts of other partners throughout the system. It is so critical that our healthcare partners and providers work with us. It's very important that we can continue to champion that message. I know the governor's office is really keen on this. We at the Department of Health are obviously, the healthcare authority is as well. All of us are committed to making sure we're doing this. So I just wanted to make sure to underscore that point as well. And Julie, with that, I think you're at the final question.
Yes, we are. Our final question comes from Kate with KUOW. Go ahead, Kate.
Hi, yeah, thanks so much for taking my question, and thank you for taking the time to do this. I also want to echo the appreciation that others have expressed for the media team. You all have been fantastic. Just wanted to ask a little bit more about the numbers. I know you've had a lot of questions around this in terms of getting to the 70%. It looks like depending on how you do the maths for this, if you add sort of the CDC's 18 and older initiator numbers with the state's numbers for 16 and 17-year-old initiators, it looks like we're already at 70%. So I'm just wondering, obviously, you're going to use the numbers that you think are best for the state, but do you have a sense of when we might hit that 70% for reopening? And then also just wondering if there's anything that you are thinking about that makes you a little nervous with reopening, if it's, particular businesses or activities that folks might be getting into once the state reopens.
Well, I hope. Okay, great. Thanks for again, this is why our team is so stellar. And I'm going to let Lacey speak about this, I think, because for some reason her camera came on. But I did want to just answer your second question first, if I may, which is, yes, we are absolutely in the field of public health concern that people think that we're completely done with the pandemic when we had a goal, any goal, whatever that goal is, whatever that milestone is. It's not over until it truly is over. And we are really concerned that folks are going to think that we're at 70% and therefore you don't have to worry about anything. And in fact, that may mean that vaccinations drop off because people think that we've already hit a statewide goal. And so I didn't get my vaccine, but that's okay because someone else got it. Well, no, we don't want that to be the message. We want that message to continue to be get vaccinated and make sure that we continue to push ahead of not just 70%, 75%, or whatever that 80 or whatever that percent is, whatever we can do, not in a comparative way across the country, not in a comparative way against anyone else. We want to do the best that we can in the state of Washington to protect people from this horrific pandemic. And that's what vaccines represent. And we want to make sure we encourage that. As far as the numbers go with the metric, I just want to make sure that it's clear. The governor's office did put out a social media message yesterday, and I hope you all saw that. And I think it was very clear both on this graphic, and again, Lacey may want to say something in addition to this, but also with what the governor's office put out yesterday, is that we want to make sure that we're using an apple-to-apple comparison. And that's what we started with, a metric of 16 plus, and we stuck with that metric throughout this process of reopening and the reopening plan that was put in place. And we want to stay true to that. We want to continue to do that. Now, as far as how long it's going to take for us, we're hopeful that it's not going to be too long and we can get there before June 30th. But again, it depends on really the number of people, Washingtonians, who are initiating vaccine on a daily basis. And so it's really up to us in terms of whether we're going to be able to get there sooner than June 30th. So Lacey, I don't know if you wanted to, your camera popped up in my screen because I was having tech issues. So I don't know if you were about to say something, but I will certainly, I know there was a specific question about the using the 18 plus and then adding in 16, 17-year-olds into that, which obviously is not an official way of doing it. So Lacey, I don't know if you want to speak to that.
I think you covered the differences. You and Michelle have covered the differences between the two numbers well. We are going to, for the purposes of our reopening goal, both as our panel here has said and the governor put out in his statement, we are going to be using the data that are provided to us in our dashboard, as well as those data that are provided to us from the Department of Defense or VA. So that green, what is on the green side, still great progress, but a ways to go. When we reopen, we've talked a lot on this call about the variants and how concerned we are about them and the need to protect all of our communities. So when we reopen, whether that is on June 30th or sooner, the state will be open for business and recreation, and people who are vaccinated can go about their regular lives for the most part. Unvaccinated people will continue to need wearing masks indoors, and that is to protect them. Not only those who are unvaccinated, but children who are not yet eligible to be vaccinated and those who have autoimmune diseases. So we want to make sure that the public is understanding where we are excited about this forward step in our journey out of the pandemic. And we also want to keep all of our communities and all of the people in Washington as safe as possible.
And I think Julie has that tweet from the governor's office, if you want to pull that up. And just a reminder that, again, as the governor's office made it very clear, and we too have made it very clear that we don't want to, we certainly have an outside date of June 30th. We don't want to rush into this with unofficial information. Again, it's whenever we have official information that we can verify at the state, and we can utilize that information like we did with DOD and VA, and we were able to add that into the mix. We adjusted. But short of that, we don't want to do back of napkin math to be able to do anything that is unofficial. And then for whatever reason, you all come back and say, well, why did you do that when you had a metric you were following throughout? So I think this is the right course. But again, we're hopeful that we can get there before June 30th. I think all of us would be very appreciative if tomorrow we had 140 to 160,000 Washingtonians initiate vaccine and we hit the 70% mark. But the reality is that it's going to depend on the initiation of vaccine by community members, and whatever you as our media partners can do to help champion and help us with that, we'd really appreciate that. So thank you, Lacey, for that answer. And thank you for that question. And Julie, I'll just close by saying thank you to all of our media partners. Again, Juneteenth on Saturday. We want to just remind everybody of the caravans and our community-based organizations making the request to be able to get vaccines in communities across the state of Washington. We want to talk to our community members about the importance of vaccination. We do not want a community member to just be waiting. Don't hesitate, vaccinate. It's the key message. Let's get Washington vaccinated, especially since we've made 6 months of progress with vaccines, but we still are not out of the woods here. We need to make sure that we continue to drive this pandemic down into the ground and be able to finish this off, which we're not quite there yet. So with that, thank you so much. And again, the reminder that we're going to be available next week, and we'll do everything we can to continue to cheer on Washington as we get to closer and closer to the 70% mark. And if that's not enough an incentive, remember, you can also go ahead and get some lottery incentives as well in the midst. So with that, Julie, thank you so much to fellow panelists, and I'll turn it back to you.
Yes, thank you to everyone. This concludes today's media availability. Thank you and have a great day.